A LASIK evaluation is a preoperative 3-hour evaluation that Dr. Northam does prior to the LASIK surgery. And there's several different tests that we have to do to make for sure that you're going to be a perfect candidate.
This is the WaveScan machine that I was telling you about, the one that does the 3D measurement.
One of the first things we do is something that is called a WaveScan measurement, and it's a machine that we set you down at, and light comes in, it creates a 3D mapping of the eye and picks up all those visual distortions. We can actually take that 3D customized map of the eye, download that map into the laser, and use that map to do the corrections. So it's more precise. It helps out more with low light situations, night driving. It actually enhances that and makes that better. It actually goes in and corrects those higher order aberrations. There's lower order and higher order, and those are the ones we haven't been able to correct in the past. We also have to do a manifest refraction.
Little eye test where we actually double check the prescription, all those fun 1s and 2s.
All
I
right.
had that done a bunch of times before.
Yes.
I bring this right over
This
here.
is the machine that you see. They put the machine in front of the face, and the one that patients always hate the most, we say, which is better, 1 or 2? 1 or 2? The reason why we do that is because we want to know which one that you actually like better. This is just one extra way that we can just double check the prescription.
Okay, I'm going to look and check your pupil size.
We also
real
like
quick.
to check the
Everybody
pupil
has different
size before we do the procedure. Everybody has a different pupil size. Some patients have larger pupils, some patients have smaller pupils, but the larger a patient's pupils are, the more light comes in. So typically those patients have a little bit more trouble with glare, night driving. So the reason why we check the pupils is because if you have a different or have a larger pupil size, sometimes we like to make our zone larger when we actually go into surgery. Correct a little further out. That helps cut down some of that glare and night driving. Another test that we'll do is something that's called a Schirmer test, and what it does is it tests for dry eye. Now, anytime you have any procedure, when you blink, you have this normal tear film secretion that goes over your eyes. When you have surgery, it breaks and it stops all that tear film secretion up. So it takes 6 to 8 weeks after surgery for your tears to get back to normal. So we like to test that. That way, if you are dry, then we'll have you use additional artificial tears over the counter after surgery just until your tears get back to normal. Of course, anytime you're going to have any eye surgery, you're going to have to be able to sign a consent saying that we can do eye surgery. But we've got a video for you to watch, and then, of course, we can go over any questions and anything that you might have there.
Sign an initial at the bottom of the page.
Okay.
We have to be able to dilate the eyes. Anytime a patient is undilated prior to surgery, when we check the refraction or the prescription, sometimes patients will have a tendency to do something called accommodate, which means either take on too much prescription or you don't take on enough prescription.
How are you today?
I'm good. How are you?
Great. I'm Dr. Northam. Nice to meet you.
you.
Finally. So
Nice to
I've been
meet you.
looking over all this data, and all of the information so far looks wonderful. But let me
Awesome.
check a couple of little things.
You can actually get an incorrect refraction or prescription that way. So when we dilate the eye, it paralyzes the ability to be able to accommodate.
Now, can you tell if the letters look a little better here?
So when Dr. Northam checks the eye, we'll make sure that we get a correct prescription. It also lets her get a good check of the back of the eye at the retina to make sure everything is perfectly healthy and
Ready
normal.
to get her done.
Good. Well, I don't see any reason we shouldn't be able to proceed, so we'll see you back in the operating room next
Okay.
time. All right? All right.
Thank
Have a
you.
good day
Nice
today.
to meet you.
Bye.